In these taping procedures, we're going to show some basic ones for the wrist. We're going to start off with the most basic, which is just some circular strips around the wrist to help support the junction between the carpal bones and the bones of the lower arm. We'll also then look at something a little bit more robust by going through the hand, help add some more stabilization to that tape job, and then we'll also finish it off with trying to prevent a hyperextension of the hand by pulling everything a little bit more into flexion to make sure that it stays secure. For this one, people may not want pre-wrap. That is a personal decision of the patient. If you're going to use pre-wrap, that's totally fine, but this is going to be our basic wrist taping. Going up, we don't need to go up more than 3 to 4 inches from the wrist. You'll see some American football players go halfway up their arm. It does not add a whole lot of extra to it. Again, we're going individual strips here as to not get too tight with going around it, but you could do a continuous. You do, again, have to be careful to not cut off circulation to the athlete's hand. You can utilize, which we did not do in this video, having them do a clenched fist, which then helps just make everything very robust, and that eliminates a lot of the potential of cutting off circulation. So in this instance, we're going to work from the lateral to the medial side, depending on how you're looking at it. If they're anatomical position, switch that by wrapping through around the wrist and going through the hand. And again, we're supporting the lateral wrist as we're coming around and that over that TFCC cartilage. By doing so, again, this is just going to make it more robust, a little bit more stable for our athletes when it comes to going through the hand versus just going around the wrist. So for this one, we added an extra anchor strip through the hand in order to go and make these strips that will post on their hand, pull them into a mild amount of wrist flexion, anchor it down while they're staying in wrist flexion. Typically, we'll go 2 to 3 of these. You can pre-tear them and then use them, or do them as you go. Again, this is just adding a little extra support. So for American football, this is really big for some of our offensive and defensive linemen to help support their wrists because they're in a constant state of pushing. Could benefit somebody that had a little bit more severe wrist injury, and this would be where you start and then progress your way back in the reverse order of which we have shown these. We're going to then want to do another anchor through the hand to make sure that those don't move, and then also go again through the wrist to make sure that we're anchoring it all down. Again, doing these continuous ones, you just have to be careful that you're not getting too tight. You can utilize other forms of tape for this to help with your desired outcome, but this is generally what all of them will end up looking like. And again, we worked from least amount of protection to about the max amount of protection in this wrist taping procedure.